12th walk with the doc. Thank you to many of you who have been here before, and thank you for making this a reality, because it's now been 1 year that we've been doing this. So a round of applause to all of you for making that happen. To those of you who are new, a very warm welcome. What we do here is we do our little health talk first. We'll go over some quick housekeeping. We take a group photo, and then we do our walk for about 45 minutes together. Does that sound okay? Yeah? Okay. So today's a little bit about me first. My name is Dr. Hussain Khimji. I'm on a mission to help people with 3 things: to help you become your happiest and healthiest self, help you manage, prevent, and reverse chronic diseases, and help you optimize your mental health and your emotional well-being. More important than that, I'm also a human being in progress, so I'm here to walk the talk with you, not just tell you what to do, and obviously get my steps in as well. Part of what I do in walking that talk is hosting the Calgary Walk with the Doc chapter. So this is our local chapter. There's over 700 of these around the world. It's actually Walk with the Doc's 21st anniversary this year, and I'm going to have an announcement about that at the end of the walk as well. So for today's health talk, we're going to talk about type 2 diabetes. Type 2 diabetes, why does this matter? It's one of the most common chronic diseases out there. It affects millions of people around the world. And in Canada, 95% of diabetes cases are actually type 2 diabetes. So that's what we're going to focus on today. Before I kind of go, why is it important to me? Is diabetes I often think about as a silent disease or a silent killer. So it often presents with no symptoms, or we're diagnosed very late in life. So we often feel like, I was suddenly diagnosed, when it's actually something that's been brewing for years. So the more you can know about it early and now, the better you can be at managing, preventing, or reversing. Does that make sense so far? Okay. Before we go into type 2 diabetes, there are different types of diabetes. Can someone tell me the other kinds? So we have type 2. What are other types? You can just shout out. Type 1, very good. What else? Type 1 and 2, there is a type 3. Do we all know what type 3 is? Type 3 is when you have type 2 diabetes or insulin resistance, but it's associated with the risk of developing Alzheimer's dementia. So there is a type 3, good. Type 1, type 2, type 3, and there's another term called pre-diabetes. Have you all heard of pre-diabetes? Pre-diabetes is a relatively new term. What it indicates is an increased risk of developing type 2 diabetes. And the way we measure it is in your blood work, which I'll talk about later. And it means that the blood sugar levels are high, more than normal, but they're not high enough to give you a diagnosis of diabetes. Make sense? Okay. So let's talk about type 2 diabetes. In terms of signs and symptoms, as I mentioned, it's very silent, but if you were to have signs and symptoms, you'd be looking at the top 3 common signs, often coming together: frequent excessive thirst, more than usual, frequent urination, peeing more often, and blurry vision. There are 2 other common symptoms to watch out for: chronic fatigue and low energy, and unintentional weight loss. As I mentioned, we do blood work in clinical practice to help you see. So this is a good time to see your healthcare provider, your family doctor. This is why screening and preventative care is so important. They will do a blood test, usually annually after the age of 40 or every 3 years, called the Hemoglobin A1c. Familiar with that? Heard about that? A1c is just a measurement of the percentage of red blood cells in your bloodstream that sugar has bound to. So A1c, there's 3 kind of cutoffs or ranges that you should know. Less than 5.7% is normal. That's good, that's what we're aiming for. 5.7 to 6.4%, that's the pre-diabetes. Again, risk of type 2. And anything greater than 6.5% is type 2 diabetes. Good? I'm gonna ask you that at the end, maybe. So signs and symptoms we talked about, risk factors we talked about. In terms of management, I think this is the most important thing, and many of you know I like to leave you with practical, actionable things that you can actually do at home and in your life to improve your health. So my top 4 recommendations or strategies to optimize your health, manage, prevent, and even reverse type 2 diabetes are the following: nutrition, movement, weight loss, and support. I'm going to tell you a little bit about each one. So number 1, nutrition. You want to try to increase and decrease 2 different things. You want to eat more of and prioritize high fiber foods and lean protein foods. The high fiber foods you want to eat more of, as you know, are fruits and vegetables, healthy whole grains, beans and lentils. The foods you want to eat less of are sugary beverages, especially but also highly processed or ultra processed foods and refined carbohydrates. So nutrition is number one by far. Movement is number two. Regular physical activity matters immensely. You're aiming for 30 minutes a day, 5 days a week of moderate intensity aerobic activity. So that's generally what we call cardio, where you are getting your heart rate up. You might feel a little out of breath. That's good and normal. So 150 minutes a week. And in addition to that, strength and resistance training, building muscle as well. So nutrition and movement. Number three, weight loss. It doesn't need to be anything extreme. Just 5 to 10% of body weight loss in clinical practice, that's modest weight loss, can significantly reduce your risk of developing or having or keeping type 2 diabetes. Number four is support. I think this is a very important pillar or reason to look after your diabetes for two reasons. Number one, medications do matter in type 2 diabetes, things like metformin, empagliflozin, GLP-1 medications. These all play a critical role to help a lot of people manage their diabetes, but it does not need to be one or the other medication or lifestyle. It can be both. They can work synergistically together. And the second part of support is community. So getting together with other people who have type 2 diabetes so you can work with each other, learn from each other, seeing your healthcare provider or your family doctor regularly, an endocrinologist who is a specialist in type 2 diabetes if you need more support. There's certified diabetes educators, nurses, and many other multidisciplinary allied health professionals who can help with type 2 diabetes. So support is that last one. You guys are gonna remember all four? For those of you who have been here before, you know I'm all about lifestyle medicine, which has 6 pillars. You would have noticed 2 of those 4 are of the 6 pillars. Sorry, 2 of those 6 are of the pillars. So we have nutrition and movement, but we also have positive social connection, part of what we're doing today, avoiding and eliminating risky substances, alcohol, smoking, drugs, high quality restorative sleep, and also stress management and stress reduction. And working on all 4 of those pillars, in addition to the 4 things I mentioned, will also help you manage, prevent, and reverse type 2 diabetes. Still with me? The very last thing I wish that you take away today, aside from those action points, is that you actually have the power in your hands, in your lifestyle, in your habits, in your choices, and in your behaviors to manage, prevent, and literally reverse type 2 diabetes. When I say reverse, it's a catchy sounding word. We can truly put it into what we call clinical remission, where that A1c number in your blood work will be below 5.7 for at least a certain amount of time based on your lifestyle management. Maybe some medication again as needed. Does that all make sense? Excellent. I promise we'll still go for a walk today. Before I get to the housekeeping and anything else, do we have any questions, comments, things anyone wants to share? You're all experts in type 2 diabetes? Yeah. Good. Good. Okay, that's fine. Yeah.
I'm to say that I've been in the pre-diabetes for 20
Yeah.
years.
Yeah.
I have been dancing.
Yeah. Yeah.
My voice won't carry on.
That's okay. So the comment was that someone has had pre-diabetes for many years and has been dancing in that range of 5.7 to 6.4. Thank you for sharing that. What I would like to share in response to that is that's not a bad thing. I see a lot of patients and clients all the time saying, oh, well, my A1C is 5.8, so it's not good enough. 5.8 is a fantastic A1C. You still don't have type 2 diabetes, or you've put it almost into remission. The other important thing about this is to maintain your success. It's not just about hitting a target, hitting a number, hitting a goal. That's a great thing to do. It'll take you 3 months. You can do a quick fix program, but how are you going to stay there for the rest of your life? So it's important to think about long-term rather than short-term. Thanks for sharing that. Yeah. Anything else?
You once made a comment to me about the optics and perception of diabetes.
About which, sorry?
A diabetic.
Oh, yes.
Have diabetes.
Yeah.
Can you touch on that? Maybe?
Definitely. Thank you. So this is one of my most important things. This is a hill I will die on. Person first language. All the time. Healthcare providers, physicians, myself included, nurses, patients, colleagues, doesn't matter what your role is, human beings, we tend to say, I am a diabetic. Oh, the diabetic in room 3. Oh, that diabetic in the emergency room. No, you are not your disease. That is not your identity. You as a human being have value and worth. I have type 2 diabetes. I have a condition that I can manage. As soon as we ascribe our value to I am obese, I am diabetic, it changes the way we look at the problem. So as much as you can catch that every time you hear yourself saying it, I am a diabetic, pause, I have diabetes, I have obesity. It now becomes something A, not tied to you, and B, something external to you which you can manage. Great point. Anything else? Good. If you have more questions, thoughts, you can catch me along the walk. Quick housekeeping, we'll do our usual 45 to 50 minutes. There's no rush, it's not a race. You can walk at your own pace. There's, in the mall, it's great. There's seating, washrooms, water. Help yourself, take your time. Please be aware of your surroundings, let other people pass by you. I will come and try to say hi to all of you along the walk, so you might see me sprinting or running here and there, but you don't have to do that. And we'll take our group photo now, and then we'll get going. Does that sound good?